The Tamil Nadu government has said that movie halls in the state will be permitted to screen movies at full seating capacity, that's 100%. But this decision to allow full occupancy in theatres has not gone down well among healthcare professionals and public health experts. In fact, a Facebook post of a doctor also went viral. It was an open letter which he addressed to actors Vijay and Silambarasan, who had met the Chief Minister with the request to open up theatres for the public, and he's also addressed it to the Tamil Nadu government. He says, from a poor, tired resident doctor, he said thousands of doctors like him, healthcare workers, police officials and sanitary workers are just tired. Well, let's go across to Sam Daniel for more on this entire story. And Sam, this comes just after these clusters of COVID infections were found in hotels. And now this decision to allow, 100% occupancy in theatres has everyone quite divided.
That's right. People are quite divided, Gargi, but certainly many health professionals have taken to social media warning public the risk involved in going to theatres which would have 100% seating occupancy, particularly poorly ventilated, closed situations like this where there will be no physical distancing when 100% occupancy is allowed, could actually lead to explosion of cases amid a declining trend in Tamil Nadu. That's what many have warned. And Dr. Pradeep Kaur, a public health expert, in her tweet has said that closed spaces without social distancing are perfect setting for explosive spread of COVID-19 and requests public to avoid such settings. And this, as you said, comes amid the reporting of 2 star hotel clusters with 125 new cases in Chennai recently. And little earlier we had IIT Madras, which also reopened for certain sections of research scholars, reported more than 100 positive cases, which was also termed as a cluster by the Tamil Nadu government. And the health secretary has said the government has put in place an SOP, and he would get back on concerns expressed by various quarters. On the other hand, theatre owners say for the last several months, close to a year, they have been suffering huge losses because of lockdown earlier. And now, although 50% is allowed there, they say it's not commercially viable, and particularly over the last few months since Diwali, when these theatres were allowed, they say they have never had a big release to be able to make up for the losses. And they say they employ around 40,000 people across Tamil Nadu in the 1,000+ theatres, and only if the government allows them to open up, they say they'll be able to salvage, they'll be able to redeem themselves, and that's their concern. And they say, besides following the established protocol in terms of hand sanitizers, not allowing the elderly to ensure physical distancing in other places except inside the hall, they would also make sure they would only provide packed food and not open food, which would again pave way for explosion of cases. Politically speaking, elections are just 6 months away in Tamil Nadu, and many are also giving a political motive to the meeting by actor Vijay, who has a huge following, and the Tamil Nadu government's decision to yield to that request, saying that perhaps the ruling AIADMK is trying to gain mileage by the popularity of actor Vijay, who also has political aspirations, and by paving way for his film to have a huge release, perhaps the government wants him to endorse for elections in terms of supporting the ruling AIADMK. Of course, off record, ruling AIADMK sources have denied these allegations as speculative, and they say we are now in an era of learning to live with corona, with all the SOPs in place, just like schools and colleges are being slowly opened up, just like institutions have been allowed, just like trains and bus services are also slowly turning to normalcy. They look at this as one part of restoration of normalcy, which many health experts and doctors individually, who also are on the front line fighting it over the last close to 1 year, they say cannot be allowed in this kind of a fashion, particularly amid the risk of the new variant and also amid the risk of reports of clusters in Chennai. Gargi.
Right, Sam, thanks so much for joining us with that, and especially, given that now the vaccine does seem to be around the corner. Well, to talk more about this, we're joined by Dr. Sumant Raman, a political commentator, Professor Dr. Anita Ramesh, and Nikhilesh Surya, Rohini Theatre owner. And first to you, Sumant Raman, if what is your reaction to this? It's a tricky one in terms of, lives and livelihood, but movie theatres, I can absolutely understand that poor doctor who's written an open letter saying we're all very, very tired, and everybody at the front line is tired and we don't want another spike in cases.
Yeah, Gargi, see, there are three very important issues here. One is this guideline of 100% occupancy violates the Ministry of Home Affairs, the relaxation guidelines which are issued. The last guideline, I think, which was issued was sometime towards end of November, which has then been extended. So, which mandates that theatres can function with 50% occupancy. So, this 100% occupancy guideline of the Tamil Nadu government is a clear violation of that. In fact, the MHA also said that states could be stricter than these guidelines, but not more lenient than those guidelines. So that's point number one. Point number two is that Tamil Nadu government consistently used to hold meetings with their own medical committee before announcing relaxations. Now, this was followed until, if I remember right, until sometime in mid-November, where the Chief Minister himself used to meet the medical committee, which included experts from ICMR and other agencies of the state as well. And after that, decisions would be announced. Now, clearly, the medical committee does not seem to have been consulted, because Dr. Pradeep Kaur, who's part of the medical committee, has clearly put out a tweet saying that, this is not safe, and literally saying, people, please don't go, So that is the second point. The third point is, I think that the entire argument of the theatre owners and, the cine fans and so on, is that rules are being violated everywhere. So why not violate rules in the theatres as well? Trains are going, air-conditioned coaches and trains are being permitted with full occupancy. Buses are allowed to function with full occupancy. So what is the problem with the theatres also functioning with full occupancy? Now, medically, that is a huge risk. And to say that, others are doing mistakes, so therefore, why should theatre owners alone be penalized?
All right, well, let's get a theatre owner in here. Nikhilesh Surya, your response to this and your, response to this decision, you, of course, must be happy, but, it's become quite a controversy in the state.
Yeah, no, it has been a long pending demand for us for the past couple of months, because the industry has still not seen a revival. I mean, there is really no point functioning at 50% occupancy, as it has been a chicken and egg problem. None of the movie producers are ready to release their movies, and we just, we've been open, but we've not been able to do anything, quite literally. With zero revenue, we're not able to function. And see, when the entire economy is claimed to be back on track, when GST collection is at an all-time high, when everything is functioning normally, even we have our financial commitments, nobody's going to give us any moratoriums or extensions or any leeway. With that aspect, or at least the government should have given us something else. So when nothing's in place and when everything else is functioning normally, like Sir said, then I really don't see a point in holding us back alone. All the festival season and all the metros and all other cities and towns of India, we saw shopping districts being crowded, and we really didn't see any great spike in cases. I mean, I'm not 100% right, but from whatever I read and saw, there was any great spike in cases during the festival season. So I think with adequate, in a theatre, it's more a controlled environment than huge shopping centers and shopping districts where you really can't regulate the crowd. Here, you buy a ticket, you stand in line in a queue, and then you enter the cinema hall. You can be sanitized, you can be temperature checked. So many things that can be done here, which cannot be done in a lot of other places, like in buses, trains, and malls and beaches. So this whole aspect of being in a closed environment, that really doesn't matter if it is 50% occupancy or 100% occupancy. Even if in the same closed environment, if 300 people are going to be there or 500 people are going to be there, it's the same. And so far, there has been no reported case traced back to cinema halls, so no clusters traced back to cinema halls in the entire world.
Well, not yet, and we don't want to challenge that. Dr. Anita, your response to this decision, are you disappointed, and widen your message to people?
Yes, I actually don't agree with that decision, because, and I'm with the public and I'm also with the healthcare professionals. We are doing very well. If you see Tamil Nadu figures, the positivity rate is just 1.53%, less than 5% the expected. And all over India, and Tamil Nadu is doing really well in COVID control. We healthcare workers are working day and night for last 7-8 months. I don't remember I've taken a day off from the work, but then we are able to control it. So we should not lose our gears. And 2 recent evidence of IIT Madras and 2 luxury hotels reporting cluster of cases frightens all of us. And the new strain out of the country is also very virulent, and people coming back to India is carrying it. The number of cases abroad is increasing. Lockdown is reimposed. So again, India might face a second wave, and we are all worried about it. So as on today, coming back to the theatres, 100% occupancy, I do not agree, because it's a closed space and it is for 2 hours somebody is going to sit. They definitely open the masks, they're going to eat, they're going to talk, push to each other and start talking, and that will be a super spreader of the virus. So, and also this all puts us into a fear that opening a theatre and 2 hours people sitting close to each other without social distancing, whatever you say, you put sanitizer, you put thermal check, you put your mask on, but you're going to sit there in the closed AC hall for next 2 hours itself is frightening. So I would not suggest that, yes, but what I will suggest, I will not suggest that 100% occupancy should be there, but as a healthcare professional, don't increase the load on us. What you can do is that, I understand India needs to bounce back. This is a particular industry, even my husband is also involved in this industry, but what I suggest is that you have the show timings increased. Maintain 50%, maintain the SOP, continue, but have more shows so that you can accommodate more people. And that people will also have confidence. Yes, I will go to a movie, I'm safe. And again, still the vaccine is completely, we are all vaccinated another 4-5 months. We should not dare to do anything which will help us to slip down.
Right. Dr. Sumant, Raman, it does seem that, you know, the reasons for opening up are not because of, as you were pointing out, that, you know, the medical committee met and advised this. It was after actor Vijay went and met the chief minister, another actor also met them, that this decision was taken. So, you know, and because of the Pongal festivities, etc. So it does seem that there were overriding reasons, and political as well, as Sam was pointing out earlier.
Yeah. Look, Gargi, across India, there is now a feeling that India is sort of immune from a second wave. Now, I don't know how different state governments and the public at large seem to have come to this conclusion, but it flies in the face of logic. Because if you look at the Western countries, particularly Europe and the US and so on, they had a huge dip in cases in July, August, and until mid or end September. And then the second wave started taking off really from October. So that we are actually 3 months behind Europe and America. So I don't know on what basis we, by we I mean the central government, state governments, public, everyone believes that the COVID problem is more or less sort of taken care of, and we will not have a second wave. Because if we look at the Western countries, and if we are assuming we are 3 months behind, then December, January is the time for a second wave to actually happen in India. There are lots of things about COVID that we do not know. Agreed. Shopping malls were packed during the Diwali shopping season. Nothing happened. No major spikes were there. But when there is hopefully an end in sight with a vaccine, may not be in 3 months, at least in 6 to 9 months, why are we actually going out and taking a huge risk? Because we do not have the infrastructure and the facilities to control a mass outbreak of a mutant, potentially mutant strain that could spread 70% faster. Remember, our hospitals and ICUs were actually pretty stretched even during the peak of the first wave. So we don't want to do something that can actually trigger a second wave.
Right, Nikhilesh, Surya. So, you know, a lot of responsibility on theatre owners, given that 100% occupancy is going to be allowed, as you said, that you wanted some sort of relief from the government, and now you're looking forward to having your theatres open. But many are also pointing out it is also the responsibility of the public whether they do indeed go back to the theatres.
Yes, of course. I think with more than relief, we were actually we are actually burdened with a lot of responsibility, and I think we are happily taking it up. And we are there is a lot of self-regulation in place among theatres. Actually, when you see the 50% occupancy and the SOPs in place, it actually made no sense, because people were asked to sit one seat in between each other. But when you're coming as a couple or as a family, there is no point in sitting separately. I mean, you're coming from the same house in the same car.
Well, I'm sure the doctors
what we are planning to do now is to make people sit in groups together and leave seats in between them, in between groups, which would make more sense. And I think it works out around 70 or 75% occupancy overall, which would be the average number. So we're looking at self-regulations like that, and we're also looking for the people to take it upon themselves to have their masks worn all the time. We will be doing our best to ensure that they'll be doing that. So
All right.
it really,
we'll just have
it
to
can't be
leave
just
it there.
pinpointed to one person. I think everybody is a stakeholder and everybody needs to look out for themselves and for others.
All right, well, thanks for
Can I
that. But
have few
clearly the
points?
doctors disagree. I'm sorry, I'm completely out of time, but clearly the doctors have many concerns regarding this decision. And it does seem that it's not, public safety that was the overriding reason to take this decision. Dr. Neeta, one last word from you.
Yes, also, if we are at all planning to open, say, like our colleague has said, 70%, but then please avoid the vulnerable society, elderly, those with
Definitely.
comorbidity. And these people should be avoided because if they get infected, they straight go to ICU. Mortality is very high, so they should be avoided. But overall, please wait till the vaccine has been given, then we can open in 100%. I understand India needs to bounce back, but we need to balance and carry on.
And it does seem the vaccine is around the corner. From perhaps next week, the vaccination drive will begin.
Next week, all of us will get the vaccine.
Thank you all for joining us on the show today for discussing this issue of the cinema halls reopening in Tamil Nadu at 100% capacity.